Okay, for this PowerPoint, we're going to talk about blood flow and perfusion and things that kind of can create barriers or resistance. Much like when we talked about airway resistance, this is kind of like the circulatory version of this. Okay, so what makes blood flow? So we're going to be talking about perfusion pressure. So when you think about perfusion, try to imagine all the different places in your body that blood flow has to go to carry oxygen, right? And that's called perfusion. You needed a high enough pressure to get the blood to all the areas of your body. And when you think about how dynamic your body is, all the movement, all the varying metabolic needs for different organs and tissues and all of these different things, it's pretty complex. So there has to be a level of pressure, blood pressure, to create circulation to all those areas and really provide that gas exchange to meet the body's metabolic needs. So your pressure gradient, or this driving pressure, is going to be produced by your heart pump, so your heart rate, and then primarily by the elastic recoil of arteries. There's other things, like more nuancy things, but we're not going to get into too much detail. So for right now, that's kind of what we're looking at. So again, you want your perfusion to be great enough to meet your body's metabolic needs. And what does that mean? It means they're going to take oxygen to tissues and remove CO2 from tissues. And you just want to make sure that blood pressure stays up high enough that you always have adequate perfusion to your tissues and organ systems. So one of the things that's going to oppose this blood flow, in the same way that we talked about airway resistance opposing the flow of gas through your lungs or impeding the flow of gas through your lungs, vascular resistance is going to oppose or impede the flow of blood through your body. So if you're talking about blood flow through a vascular system, it's going to be opposed by frictional forces. This should sound kind of familiar. Airway resistance is a frictional force that opposes the gas flow in your lungs, okay? So there's some overlap here in these two systems in what we're talking about here. So resistance is delta P over flow. Again, this should look pretty familiar. The difference here is what the delta P is. So change in pressure over flow. So when we're looking at change of pressure for vascular resistance, we are going to be looking at the entry point, which is the artery leaving the ventricle. So you have your pulmonary artery and your aortic artery. And remember, the right and the left, although you do have the order of blood flow, the right and the left are going to be filling at the same time and ejecting blood from the ventricles at the same time. So the entry point is like the ejection of blood from either ventricle, either the right ventricle or left ventricle, into the artery. So you've got your pulmonary artery on the right and you've got your aortic artery on the left. The exit point is going to be the atrium at the end of the venous system. So if you can imagine, on the right hand side you have your right atrium and you have blood coming back, exiting, if you will, the systemic circulation through the superior and inferior vena cava. And on the left, you have blood entering the left atrium or exiting the pulmonary system via the pulmonary veins. So that's your exit point. So that's your delta P. And then your flow is your cardiac output, right? Because it's in liters per minute, we know that. So your flow is your cardiac output. So that's what you're looking at for vascular resistance. So we have two different kinds of vascular resistance we're going to be looking at because we are going to be talking about two different circulatory systems. So your systemic vascular resistance is your body, your systemic circulation. And it's going to be looking at your mean arterial pressure, and that is abbreviated MAP. This is the entry point into your systemic circulation, and the entry point into your systemic circulation is your aorta, your aortic artery. It also is going to be looking at your right atrial pressure, or your RAP, and that is the exit point of systemic circulation, or your right atrium. You're then going to divide it by cardiac output. So you have MAP minus RAP divided by cardiac output. Okay, and I swear, I know that this probably seems goofy when you're just starting to talk it through. But again, if you can imagine here, the entry point in systemic circulation, this is your left ventricle trying to eject blood into your aortic artery, right? And it's going to have to eject that blood into your aortic artery. It goes through that aortic artery out to all the different systems in your body, and then it comes back or exits that systemic circulation as the deoxygenated blood through your superior and inferior vena cava into your right atrium. So we're looking at that giant loop, okay? When it leaves the heart, it has a certain pressure, and by the time it comes back to the heart, it has a different pressure. So we're going to analyze the difference between those two pressures, and then we're going to divide it by cardiac output. And this is going to measure the average amount of resistance that your left ventricle is working against, or that afterload, to try to eject a stroke volume into the systemic circulation. That's what we're looking at here. You also are going to learn about your pulmonary vascular resistance. So we have talked a lot about the difference between systemic circulation and pulmonary circulation. So systemic circulation, because it's going out through your whole body, it's a higher pressure system, right? And your pulmonary circulation only goes to your lungs, and it's a low pressure, gravity dependent system. So you have your pulmonary vascular resistance, and its entry point is going to be the pulmonary artery, okay? So the entry point here was your aortic artery, because we're talking about your systemic circulation. We're talking about the left side of your heart. Here we're talking about your pulmonary vascular resistance, or your pulmonary circulation. So the entry point is going to be your pulmonary artery. The mean pulmonary arterial pressure is abbreviated MPAP, okay? Your exit point is going to be your left atrium. And if you can kind of imagine this in your brain, you've got your blood going from your right ventricle into your pulmonary artery. This is your entry point. It's going to go into your lungs, gather up all of its oxygen, and it's going to come back to your heart through your pulmonary veins and drain into your left atrium before then going out through your body. So your exit point is actually your left atrium. So this is a smaller circulation because you're just going into the lungs and back to the heart. And that left atrium, the pressure there is called your pulmonary capillary wedge pressure, okay? So the difference in pressures that we're going to be looking at for your pulmonary vascular resistance are your MPAP minus your pulmonary capillary wedge pressure divided by cardiac output. I put the normal values for all of these and what they mean in a handout, and then I put it in a PowerPoint in 2 places. You guys are responsible for the normal values and knowing what these acronyms mean, okay? So we will talk about this at length. You guys will get really familiar with these and the concepts surrounding them. I will give you lots of practice for patient case scenarios. So this is just the introduction. Don't panic. we'll go over it more in class. These are your normals. So for systemic vascular resistance, the normal is 11.25 to 17.5, and this is going to be in millimeters of mercury per liter per minute, okay? And when you think about why, you've got change in pressure, so that's your millimeters of mercury per flow, right? Over flow, which is in liters per minute. So that's where those units come from. So because we're talking about your systemic vascular resistance, this is going to show us what our left ventricle's working against, or our left ventricular afterload. Your pulmonary vascular resistance is much, much lower if you look at it. It's 1.38 to 3.13. So that's significantly less than the normal for the SVR. And again, if you think about why, your pulmonary circulation is that low pressure, gravity dependent, small little circulation. You're talking about a circulatory system that's just going from the heart to the lungs, back to the heart again. That's all you're talking about when you're talking about pulmonary circulation. Your systemic circulation is going from the heart through your entire body and then back to the heart again. So it needs more pressure, right? So that's why this is so much lower. Same units, and it's going to signify the same kind of thing, except for on the right side of the heart. So this is going to show us what the right ventricle is having to work against, or the right ventricular afterload. And we kind of just talked about why the PVR is less than the SVR, and what do we know about the pressures of each system. So that's why this one is higher than this one, and that's what we just talked about here. So again, your systemic vascular resistance is how much resistance is working against that left ventricle to get blood out to your body. Your pulmonary vascular resistance is how much resistance is working against your right ventricle to get blood into your lung. And I'm just going to drive this point home again. Really understand your circulation, guys. Understand where blood is coming from and where blood is going, and the order of blood flow, or all of this conceptual type hemodynamic portion of this is going to get really confusing. These are your lecture questions. If you have any issues with them, definitely always feel free to email me. That is it for that guy.